A 67-year-old is brought to the emergency department by paramedics. He is complaining of palpitations for the last 3 hours. He denies shortness of breath, chest pain or any episodes of loss of consciousness. He has a past medical history of chronic kidney disease. An ECG is performed at triage which shows a regular, broad complex tachycardia with a rate of 140 beats a minute. His observations are recorded as heart rate 140 beats minute, respiratory rate 21 breaths minute, blood pressure 123/75 mmHg, GCS 15/15. What is the recommended dosing regime for amiodarone in this patient? Options are A. 150 mg IV bolus, followed by an IV infusion of 300 mg over next 20 to 60 minutes. B. 300 mg IV over 10 to 60 minutes, followed by an IV infusion of 900 mg over the next 24 hours. C. 300 mg IV over 20 to 60 minutes, followed by further 300 mg IV infusion over 20 to 60 minutes if no response. D. 300 mg IV over 5 minutes, followed by an IV infusion of 900 mg over the next 24 hours. E. 150 mg IV bolus, followed by 2 further 300 mg IV boluses if no response. Answer is B. 300 mg IV over 10 to 60 minutes, followed by an IV infusion of 900 mg over the next 24 hours. A ventricular tachycardia, or broad complex tachycardia of uncertain origin, should be treated with amiodarone 300 mg IV over 10 to 60 min, followed by an infusion of 900 mg over the next 24 hours. A 65-year-old man presents to the emergency department with worsening shortness of breath. He has a past medical history of ST elevation myocardial infarction for which he underwent primary PCI 3 years ago. He has noted increasing shortness of breath on exertion over the previous 2 months. On examination you note fine bibasal crepitations and bilateral pitting ankle edema. His observations are recorded as heart rate 93 beats minute, blood pressure 137/62 mmHg, respiratory rate 22 breaths minute, oxygen saturations 93% on air. Which of the following is the most appropriate first-line treatment in this patient? Options are A. Sublingual glyceryl trinitrate 800 micrograms. B. Intravenous furosemide 40 mg. C. Intravenous glyceryl trinitrate infusion 10 micrograms min. D. Commence non-invasive ventilation. E. Intravenous morphine 5 meters. The answer is B. Intravenous furosemide 40 mg. Acute heart failure. Give an intravenous loop diuretic if there are symptoms or signs of congestion. If the patient is already on long-term diuretic therapy, give an initial intravenous dose that is at least equal to the pre-existing oral dose. Give the diuretic as either intermittent boluses or a continuous infusion. Adjust the dose according to the patient's symptoms and clinical status. Monitor the patient's weight, renal function, and urine output carefully while they are taking diuretics. Do not give vasodilators routinely in patients with normal blood pressure. Consider them in specific circumstances. For example, for concomitant myocardial ischemia or aortic mitral regurgitation. If intravenous vasodilators are given, monitor the patient's symptoms and blood pressure in a critical care environment to ensure systolic blood pressure remains 90 mmHg. Chest X-ray findings in congestive heart failure. A. Upper lobe diversion, distension of upper pulmonary veins. B. Curly B septal lines, fluid in the interstitium. C. Bat's wing hilar shadowing, blurred margins of the hilar vessels. D. Fluid in interlobar fissures. E. Peribronchial or perivascular cuffing and nodules. F. Pleural effusions. G. Cardiomegaly.